Hey guys, it is Brooke Olson here with the Physio Revolution, and I am on part 2 of our series of our 3-part low back pain talk. So anyways, day 1, if you didn't see it, make sure you go back and look at the video. Day 1 was about how prevalent back pain is and the probability of you actually having it, or any person here actually having it. So we discussed a little bit about how prevalent it is, and then we also talk about why this is actually occurring more frequently than we actually really hope for, right? And then on top of it, I give you a little bit of a tip on how to make sure that you're paying attention to your symptoms that are happening and when it's absolutely necessary to get in and see a provider if you're having a low back pain occurrence. So part 2 is going to be a little bit more about a self-assessment tool. Now, I'm going to add another video to be able to explain this, and then I'm going to make sure that you understand that, you know, for safety cautions, just please understand that if you don't feel comfortable or you don't feel you're in a safe environment to be able to do this, or if you don't have a second person, you should not be doing it. This is my disclaimer, right? My disclaimer is don't do something that you don't feel comfortable with doing, and if it's unsafe or it's going to harm you, by all means, I don't want you to do that. I want you to be safe if you're doing a self-assessment. If not, please just come to me or come to your provider and ask them if we can do this endurance test. So we're talking about an endurance test of musculature, right? Because throughout the day we need to be able to sustain and be strong and be able to be upright and move and be agile, right? We have to be able to have our backs being able to support us throughout an entire day, and then the following day and the following day. And honestly, that takes a lot of endurance for muscles to be able to withstand that. Now, typically if you're sitting more often, I can probably tell you maybe you're not sustained for endurance unless you're, you know, without a back support throughout the day. You're up and moving quite frequently, making sure that you're doing those things. You know, one thing I always tell my patients is motion is lotion. You know, you gotta get the spine moving, you gotta get the body moving. It does not perform well unless you don't. So let me talk you through this process. I'll show you another video here of me performing the actual test. I'm the patient. I have somebody holding down my legs to keep me safe, or otherwise this isn't going to be okay. So don't do this if it's not safe for you. So let's walk through this self-assessment here really quick, and then we'll talk about it. Thanks so much. First of all, I just want to point out that in this test I have a nice solid surface to support myself with, and then you can see there's a stool in front of that area as well. So as I walk over, you're going to find that I get on the table, I support myself to where my hips are drawn all the way forward and my stomach is no longer on the table. I use the stool to support my upper body. I cross my arms over my chest as somebody is giving me good support into my legs. And I'm trying to stay as parallel to the table as I can. Now, the moment you would stop this is if you had to use your hands to lower yourself or you found yourself not parallel to the table. Typically, we like to stop this test after 5 minutes because that is the stopping point. But what I like to do is test my patients and see how long initially they can do that without having to stop the test. And then doing exercises over a period of time and then retesting it and see if the spinal musculature got any stronger. This is a special endurance test that you can try only if it's safe for you. Alright, so now you really understand how you can do one of the tests to make sure that your endurance is there in the posterior musculature of your spine. Now, if you're finding yourself in a difficult position to sustain that for a long duration, like what we talked about, then, you know, it's not typically something that is quite abnormal at this point, because more than likely a lot of people aren't really focusing on that area of their spine, right? And then on top of it, we have to like do this corset the whole time, right? You gotta have the front, you gotta have the sides kind of stabilizing, and then you gotta have the back musculature to be able to kind of have this like natural corset of the body that, you know, protects the spine, allows it to move as it should at the same time without creating injury. So I hope that this was really helpful for you, and ultimately that you find some sort of reward out of being able to test yourself safely. Remember, always safely. Please don't do this if you don't have another person. You're gonna wound up like hitting your head or doing something, and honestly I don't want you to do that, so don't do it if you don't have somebody. And secondly, if you need help about performing this, by all means, go to your local physical therapist because they know this test by heart. So make sure that you are being safe and that you're not harming yourself. And I hope that this serves you with some more education on how you can assess yourself, And then on day 3, we're going to talk about how can you get that area a little bit stronger, right? So I'm going to give you a little bit of a glimpse into what you can focus on just for the time being, and making sure that you're actually activating some of these areas a little bit. So look forward to part 3. I hope that this helped you, and I'll see you on series part 3. All right, bye-bye.